Shalom and good afternoon, everyone.
平安，大家下午好。
So today we have a special CLM.
我们今天是个非常特别的群体生活会议。
First of all, I came to know that there's not many very serious issue to discuss.
因为今天呢没有太多严重的问题需要讨论。
And I take it either positively that everyone is very happy.
我很正面的看待呢，这是表达一种呢，大家对我们的群体生活非常的满意。
But on the other hand, I'm very worried that you feel that you don't have any mood to bring anything up because we won't care about you.
又或者可能真的大家觉得呢讲也没有用呢，大家就不讲了。
I hope that it's not the second case.
希望呢不是后者。
I want to assure you that if there's any issue that you want to address and talk about, you can always come to us.
我可以肯定的告诉你们，如果你们有任何的问题的话呢，可以提上来。
Today we will have a special session to give us some knowledge about tuberculosis.
我们今天有个特别的环节，就是什么？关于那个肺痨的
So the reason for us to think this is a pertinent subject is because we may have someone among us that will be is sort of infected with tuberculosis.
之所以这个问题呢，是我们要处理呢，是因为我们的当中呢，有人呢可能会
好像被感染了，
有被感染到，
肺痨感染。So we have today with us Dr. Raymund.
我们今天有这个 Doctor 在我们当中。
So he is a consulting specialist in several hospitals, including Mawar.
他是这方面的专家，也是在 Mawar Hospital。
He happens to be the husband of our staff Shireen.
所以我们这个财务的丈夫。
对，我们的那个职员呐，Shireen 的丈夫。So he will be sharing with us about TB and give us some knowledge about it.
他跟我们分享呢关于这个肺痨的事情，让我们有一些的知识。
He will be sharing only in English. I want to ask permission from those who are from the Chinese track whether you are okay with it or not. Just English.
他大概呢只用英文来分享，不懂中文，不知道你们可以吗？
So then we will, so that we can spare, don't have to have the Chinese translation.
所以我们就没有中文的翻译了。
But on the other hand, for the BM group, kalau perlu terjemahan, mungkin kamu kena duduk sama-sama dan minta satu orang untuk tolong translate lah. Ini pasal TB punya, penyakit TB ya, ceramah tuh. Okay. So afterwards, after the presentation, there will be a session for question and answer.
当呈现完过呢，我们有个 Q&A 的环节。
So then we can bring questions to Dr. Raymund to see, to get some answers.
你们可以提上你们的问题的时候。
So without further ado, I'm going to pass this over to Dr. Raymund, and he will tell us about tuberculosis.
我们就把时间交给 Dr. Raymund。来，掌声欢迎啊！
All right. Good afternoon. Right. Okay, so I'm Dr. Raymund. So I'm a lung specialist. My primary practice is in government hospital. I'm with the general hospital. I'm a government servant. Probably you can see from the car I'm driving. It's actually not a very expensive car, right? Right. But I do a little bit of part-time in Mawar Hospital as well, because I've got very high maintenance at home, right? So, okay, kita ada sebab kenapa kita hendak bagi sedikit ceramah pasal tuberculosis lah. There's a reason why, right? Because one of our colleague has been diagnosed of having TB, right? Now, TB, tuberculosis, 肺痨, right? Trust me, I don't know what they say in Tamil, right? So it is a disease, right? So when you remember 2020, apa yang berlaku pada tahun 2020? Boleh ingat tak? Tak ingat. I think probably all of you were very small at the time, isn't it? Right? No, right? I'm just complimenting your age, right? So 2020 bulan 3 something happened, right, in Malaysia, right? We had COVID, right? So, do you know, I was very, very busy during COVID. Do you know why? Because most of them, they had issues with the lungs, isn't it? Now, if you're going to ask me, kalau kamu tanya, kenapa, what COVID has to do with the lungs, right? I'm sure you will know. Because of transmissibility. Bagaimana seseorang tu dijangkit penyakit, right? Ada tak siapa-siapa dekat sini yang minta, oh Tuhan, saya harap saya dapat TB hari ini? Ada tak siapa-siapa yang doa macam tu? Right? So, basically what I'm trying to say is that we don't want TB, but you can get TB, even without asking. Do you agree with me? Right? Like for me, do you think I should get TB? Yalah, pada muka you kan suka jaga orang TB kan? Kan? So can I say, should I be surprised? Oh my God, did I get TB? I shouldn't be surprised, isn't it? Then why am I still doing this job? Huh? Duit dah. Okay, so let me tell you lah, what happens if your neighbor has TB? How you should react? Apa yang perlu kamu buat jikalau saudara kamu ada TB, right? So my slides are actually not meant for public lah, basically because this is supposed to be for healthcare workers lah, right? Now, we always believe in prevention. Do you agree with me? Right? Kamu tak nak jumpa doktor, betul tak? Ada orang suka jumpa doktor. Cita-cita saya hari ini ialah nak jumpa doktor. Ada tak siapa-siapa? Right? I'll be very happy lah. Oh no, she has no choice lah. She has to come to the house, I mean she has to see me lah, right? So which means that we always talk about prevention, right? So the prevention of TB is BCG. Do you know what is BCG? Okay. Ada tak siapa-siapa yang dapat BCG? How do you know whether you've been vaccinated or not? So you just have to look at your arm, right? So is there a scar there? Ada. So what if you don't have a scar? Right. So those who are not born in Malaysia, those who are born elsewhere, for example, the US, right? Because some countries in the world, they don't believe in BCG. So are they wrong? What do you think? So which means that there is some inadequacy in BCG. That's what I'm trying to get. Apa yang saya nak bagi tahu ialah BCG doesn't confer lifelong immunity, right? Otherwise we won't be talking about TB, right? So what I'm trying to say is that it's okay for you to get BCG, but you must understand that it doesn't confer lifelong immunity. Then kalau dia tak bagi apa-apa protection or anything like that, why do I need to get vaccinated? Just like why you got vaccinated for your COVID. Anyone did not get, is there any anti-vaxxers around here who doesn't like vaccine? No one wants to admit lah kan? Right. So vaccine is important. Why? It tries its best to reduce the intensity of the disease itself, but it doesn't tell you that you will not get it. So what I'm trying to say is that all of us will have BCG. You can argue with me, doctor, I've got BCG. I should be immune to TB, but unfortunately you are not. Right? So you can get TB, right? Of course, the next one will be active case finding, which means that I have to go publicly to look at them and, hey, ini muka ni nampak macam muka TB, can you please follow me to the hospital or not? Or which one will be better, whether you come to see me or I come to you? That will be better lah. If I start going and seeing people, then probably there won't be anyone in the hospital, right? So active finding, contact tracing. Now, what's the meaning of contact tracing? Contact tracing bermaksud if let's say one of your friend ada TB, you are considered to be a person in contact, betul tak? And it necessitates you to go and get yourself screened. Does it make sense? Betul tak? Kalau katakan seseorang yang kamu tahu dia ada TB, right? You will be called as a contact, and you are required by the government. By the government, yeah, because TB is notifiable and atas Akta Penyakit Berjangkit 1988, Akta 324, right? So you have no choice. Kamu akan dihendaki pergi dekat klinik yang terdekat untuk do some screening. Now, what is screening? Screening maksudnya you don't have symptoms. Kamu tak ada tanda-tanda. So what tanda-tanda are we looking at? Do I come to, you know what, tengok muka I, muka I nampak macam ada TB. Ya ke? Is that the tanda I'm looking at? No. So what, apa itu tanda? Tanda means that it is where the TB affect you first. Kan? So macam saya katakan tadi, COVID affects the lungs, TB affects the lungs. Right? Because that's how you get transmitted. Macam mana seseorang tu dijangkit dengan TB? Semasa dia terhidu. Do you breathe? I'm sure you do, right? How many breaths per minute? Oh, doktor, I tak tahu sebab I tak kira. Yeah, always don't take for granted. Yeah, lungs are very important. Not because I'm a lung specialist, but you can't live. Every breath counts, kan? So 12 to about 20 breaths per minute, right? When you inhale, do you know what you're inhaling? Do you ever consider what you're inhaling? Some more? Oxygen? Some more? I knew when I come to this place, I cannot run away from spirituality, right? Oh God, please give me the wisdom. All right, you're very right. Right? Not to the word of mouth. All right, okay, so we don't know what we are breathing in and breathing out, right? But at the same time, you can also breathe in something that you should not be breathing in, right? For example, germs, right? Siapa pernah naik kapal terbang dekat sini? Semua pernah kan? Right? Do you know the person who is sitting at your back at the third row was coughing away and he probably may have had TB. Do you know that? Dia tak tahu because it's not part of your ticket what? Kan? Tiket bagi tahu tiga kat belakang tu ada TB. You nak duduk sana ke? You don't know. So, I'm cautioning you, right? You can get TB anywhere. If you're flying, not necessarily jikalau you have a housemate or roommate or bed partner who has TB, right? You don't know, right? So now, you become a contact and then you need to be screened, all right? So far, okay again? Are you guys with me? All right. So I'll go. There are many slides, basically. So these are all classified government documents, lah. All right. So these are all administrative control. What you're supposed to do now. Let's say you unfortunately have got TB, lah. So what are you supposed to do? Besides praying and fasting and ask God for, miracles to happen, the next thing that you can do is, of course, let's say you're confined to a place, you can open up the window, right? Now, why are you opening up a window? You want fresh air, right? TB doesn't like fresh air, so you want to get it diluted, so you open up the window. Not only that, we want the ultraviolet from the sun, it can kill TB bacteria, all right? So, of course, proper ventilation, negative pressure, all these are all, it's something that if you want to go to the extreme, let's say some filtration and all that, some ionizers that you have, you actually can use it, right? Okay, so these are all. Now, the other thing I want to tell you about is wearing a mask, all right? Can you remember 5 years ago, right, not too long ago, that you were wearing a mask? Can you remember? Cannot remember already. All right? And why were you wearing a mask? Because two things, one is that you don't want to transmit to others, and you feel that others should not transmit to you as well, right? Do you think it was working? Do you think mask was working? No one did any study what? Is it ethical to do study? Okay, hari ni you pakai mask, lepas tu you pergi jumpa orang yang ada TB, keesokannya lepas tu you pakai mask. We don't do that kind of studies lah, because we don't put anyone in danger and do statistics on them. Pada muka you dapat TB. Kan? Right? We don't do that. So, but anyways, the mask is very important. Right? I am still talking to you here. I've seen a lot of TB patients, right? The fact that I still wear my mask, I still wear my double mask and all that, right? Because it has helped me a lot. It has helped me for me not to get COVID. It has helped me from not to get any pneumonia, right? And especially for TB. Now, there are many types of mask. There is a plain surgical mask, and of course, there's N95, right? That you guys, we can use now. So, do you have to wear this? Not really lah. Okay, so there are ways to wear a mask. There are about 6 steps. I won't be going into detail, right? So you have to make sure that the mask is adequately worn, right? Okay, so now, jikalau seseorang tu ada TB, right? And how long do you think the person has to wear a mask? Is it for lifelong? Oh, hari itu tahun 1972 hari itu saya ada TB, and now he's 50 years old still wearing a mask. Boleh ke? Boleh ya? Unless you fell in love with the mask. Right? Right? So roughly it takes about 2 weeks, right? 2 minggu saja. Kalau katakan seseorang tu ada TB, right? Diagnosis of TB, and the patient is on medication, right? After about 2 weeks, selepas dia makan ubat, kita anggap bahawa pesakit itu tidak perlu or doesn't have the transmissibility to another person. So, about 2 weeks, roughly, yeah. So, alamak. You thought it finished, right? Belum habis lagi ya. Wait. Okay, all right. Now, etiquette, right? So, how do you cough? How do you sneeze? Right? You can actually see a person's etiquette by the way the person sneezes, the way the person coughs, right? If anyone is looking for a potential partner, boyfriend, girlfriend, look at that first. Your marriage will be very happy after that, right? So these are very important, right? The way you cough, you know, right? Do you know a graceful way of coughing? Ada, right? We have realized that ladies, as compared to men, their cough is more feminine. And you know what happens to TB for a patient who has a very feminine cough? We notice that the TB has got that's my own theory lah, it affects more, right? Because the way they mobilize the phlegm is not as good as a man. The man's cough is very strong. You're able to mobilize the phlegm, and then probably you want to spit it out. But the ladies, they hate to spit out. They keep everything within them because they sacrifice a lot, right? And then the TB gets worse, right? So but the point is that I'm telling you regarding transmitting to others. Ladies, they like to keep it to themselves. They don't like to transmit lah. Yeah. So, but anyways, any disease for that matter, right? You need to think about others as well lah. Kalau katakan kamu ada TB and you have to have a cough etiquette. Do you agree with me? Okay. Anyone doesn't agree with me? Okay. All right. Fine. So tips to reduce transmission is that good ventilation, sunlight, wear a mask, and if you have sputum, don't spit everywhere. Have you seen or not? Everyone likes to spit all over. Do we still do that? Right? So again, I'm telling you, it's not a good etiquette. If you need to spit, you need to do it gracefully. Right? Okay. So how to prevent? Yep. Okay. All right. So I just want to tell you something about TB. If a person gets TB, right, don't belittle or look down upon the person, right? Because it was not something that they ask for. Kan? Correct or not, right? They always incorporate TB with a low social economic status. Why? Because they say that, oh my God, he doesn't know how to take care of himself. There's no cough etiquette. They lived in a very crampy area, right? There's no proper sanitation. Padam muka, that's why you got TB, right? So we don't want that. You should not look down upon them, but in fact, you should encourage them. But you have to give them adequate support, assistance when they need to go to the hospital or things like that. So now, when you get TB, do you think that you want to take the person in your car anymore? Oh my God, you got TB, yeah? I don't think so. You should be riding with me, right? As I said, berapa hari? They will, 2 weeks, 12 to 14 days, right? It reduces the transmissibility, right? Now, 80% of the TB, it's a pulmonary TB, a lung TB, right? So, maksud dia apa? Right? When you get a TB, because the way you get a TB is to inhalation. So, the first place where it lands, dia dekat mana? Dekat paru-paru. So, the person will have symptoms of the lung. Okay, what are the symptoms of the lung? Apakah tanda-tanda yang pesakit itu ada radang paru-paru? Dia akan batuk, betul? Right? Cough. Right? Ada tak orang TB yang tak pernah batuk? What do you think? You were telling this doctor is asking more questions and answering my questions, right? Right. So you can, right? Ada TB yang kamu tak perlu batuk, it just will have some fluid in the lungs and all that. Not necessarily they must cough, right? But they lose a lot of weight, right? So who wants to reduce weight here? Anyone planning to lose weight? Don't have to pay anything. It's free of charge. Right? If you get TB, I can assure you, you can lose 10 to about 15% of your body weight in a very, very bad way. Right? So that's not our intentions to lose weight, but people who lose weight, unexplained weight loss, this is something that you need to consider. Why? So it's cough, shortness of breath, and sometimes ada kalanya mereka akan batuk berdarah. Pernah dengar tak? Right? So many of the patients who come to see me, batuk tak apa, tetapi the moment they batuk darah, that is very alarming for them. They will come to see me. Doktor, kenapa? I tak tahu lah, doktor, tiba-tiba I batuk, keluar darah. Is it normal for you to cough blood? Would you want to stay at home for a while until you see the blood disappears by itself? Right, so something very alarming. When you start coughing out blood, please don't stay at home. Please come and see lah. Can see anyone lah. Okay. Alright. Then shortness of breath. Jalan sikit dah mula mengah. Jalan sikit dah mengah. Okay, kejap I duduk sekejap dulu baru I nak jalan. Wih, jauhnya. Actually it's just over there, but it's about 50 meters, but actually they can't walk. Right? Because they get shortness of breath. So, few things. Cough, shortness of breath, losing weight, fever. Right? Especially at night. They have night sweats. So these are the signs that the person is having some infection, and mainly for TB. All right. So I think, what are the high risk groups? Right? Do you think everyone here can get TB? Yep. If you are very unfortunate, right, you can get TB. But believe it or not, if, let's say, one person is coughing, over here right now, not everyone will get TB, Not everyone. Right? Who's coughing? No, it's just a demonstration on how you cough. Right? Okay? So, not everyone will get TB here. Kenapa? Why? Why is that you don't get? So it depends on a lot of factors. One of it is a human factor that is something to do with your immune response, immune system, right? Now, do you think you have a good immune system? I don't know, doctor, because I never checked. How do we check your immune system? Is there a meter, immune system reading meter? Tak ada kan? Right? So basically, we also don't have lah. We just have to take some blood and see your total white counts. Right? We have few numbers of cells. For example, the white count, the lymphocytes, the eosinophils, basophils, monocytes, macrophages, and all that. We have certain cells that we can look at. Right? But how to improve your immune? Any idea? 1 tablet 3 times a day. Adalah doktor boleh makan pil untuk naikkan kita immune system. Actually, we don't have it's all about your genetic makeup. Number 2, your environment. And of course, your attitude. Stress. Is there anyone who is very stressful here? All right, you can see. Okay. Oh no. Okay. Do you know stress works adversely to your immune response? Right? Especially before your exam. Be very careful. You are stressed out with your exam and you can easily get flu. Right? So that's why you have to be careful. So try to manage your stress properly lah. And also your diet. Diet is very important. Suku separuh, you know, isn't it? How much of carbohydrate you need to take, how much of vegetables you need to eat, right? And of course, some of them, they like supplements. If you want to take supplements, go ahead, right? But most importantly, if you have any other disease, kita ada penyakit lain, seperti kencing manis, darah tinggi, sakit jantung, 3 serangkai dipanggil, right? Any of that. So any of those who have got these problems, there's slightly high risk of getting TB. All right? So when you have this and the person is in front here coughing, there's a very high likelihood that you may get TB. The one beside you who has got good immune response may not get lah. All right? Okay. I think that I don't want to go so much on the TB control program and all that. Actually, this is the Malaysian government's, Kementerian's effort to reduce TB. The reason why, because the government is spending a lot of money, right? These medications are very expensive. So when you come to a government clinic, do you think how much of money you need to pay for a treatment of TB? You have any idea? 1 ringgit. Actually, it's free of charge, right? Not even 1 ringgit. It's free, kosong, zero. So I don't get paid, right? So you can imagine lah, I'm working for no salary. Love gift. Yeah. So the government has decided not to charge anyone with TB money. Why? Because this is a form of an encouragement for them to come. In fact, there is an association, MAPTB, Malaysian Action for Prevention of TB, who gives you money for coming to the hospital. Pernah dengar? So doesn't mean that you should get TB lah. Right? So every time you come for TB treatment, you get money. Pernah dengar tak? Tak pernah dengar. So a lot of things are, so the emphasis is on the treatment. The emphasis is on diagnosis. The emphasis is on reducing the transmissibility. All right. Okay? So I'm going to stop here now. Right? I'm going to open for questions. Right? Is that okay? All right. Come. Any questions that you want to ask about TB? I know I'm very, very short. Probably you didn't understand you don't know what the hell the topic is about. The topic is TB, yeah? By the way. All right. Any questions so far? Okay, very good question. How to get the money? All right. First and foremost, you need to get TB, right? Right. Sorry, you cannot get that. Tak ada orang sengaja untuk dapatkan TB, right? But what I'm trying to say is that if you get TB, what are the things you're supposed to do, right? Or if you don't know that you have TB, what you are supposed to do. Let's say, for example, you have some symptoms, right? Macam saya katakan tadi, 80% is TB of the lungs. The other 20% can be TB of any other place. TB of the brain, TB of the eye, TB of the gut, TB of the reproductive organs, anywhere. TB can get anywhere, right? And the worst TB of all this TB is TB of the brain, because the mortality rate exceeds more than 50%, right? Right? Many of my patients who got TB of the brain, they don't make it, right? They will succumb, either that or they go cuckoo a bit, right? They'll have a lot of seizures, epilepsy, right? And very difficult to control, right? So kalau kita ada tanda-tanda yang kamu rasa ganjil, tak pernah ada macam ni dulu, asyik sakit perut aja, asyik nak pergi buang air besar saja, right? Ataupun kencing berdarah, right? Things like that, don't leave it for next semester. This semester I got exam, tak apa, I sit for my exam first, then probably next semester I'm free, then I can come and see the doctor, right? So unexplained weight loss, you're sweating, don't complain to the admin, said your aircon is not working, right? Something is not right, right? You're sweating for no reason, for example, they call it night sweats, right? So you need to come and see, because there's something wrong with the thermoregulator in your body, right? These are part of TB actually, okay? All right. So how do we diagnose TB? Come, yeah. Yeah. All right.
Saya ada soalan. Semua adik-beradik saya, dia ada tanda BCG, tapi saya tidak ada tanda BCG.
Oh, tak
apakah
ada.
saya
Kamu baru dapat tahu ke?
Sudah lama. Tapi saya sudah beritahu, dan ibu saya dia kata sudah dapat suntikan. Jadi pertanyaan saya, perlukah saya disuntik semula?
Okay, alright. So we have a quack doctor here who wants to answer the question. Unfortunately, no. Alright. So kamu tak perlu suntik. Macam saya katakan tadi, BCG hanyalah untuk kanak-kanak, baby. Semasa dia lahir, kita akan bagi one shot, and after the age of 12, we give another shot. Only 2 shots, right? But now the new immunization program, they've taken away the second booster dose. They say, find that US tak bagi, kenapa pula kita nak bagi? Right? So, but if you ask me, a BCG is important for children, younger age group, because they have not developed the immunity yet, right? So if they get a TB, and that's going to be a very, very severe TB. So BCG helps it to reduce the severity. They may get TB, but the severity will be much lesser, easier to manage, right? So that's BCG. Right. Ada soalan lain? Langsung tak ada. Kalau tidak, nanti saya tanya soalan. This is free, you know, you don't have to pay. I'm telling you seriously, right? Tak ada soalan, langsung. Semua dah faham.
Doctor.
Yep.
Can I ask from up here?
Yep.
Okay, for COVID, right, we like worry about you say transmit through air, right? Lungs.
Airborne, yep.
But then during COVID, they also say that surfaces, cleaning surfaces and all this, right? So how long does TB survive outside the body? You know, like, is there other precautions, like cleaning the things that the patient has and all that?
Okay, the good thing about TB is that it doesn't get transmitted through a material. For example, if you soil, kalau katakan kamu berjabat seseorang yang ada TB, you don't get it. It has to be inhalation, right? And how do you need it? If the patient is coughing, if the patient is singing, yes, karaoke, right? If the patient is sneezing, bersin, coughing, sneezing, singing, there's a chance that it's transmissible, right? So human to human, faham? Bukan daripada from a surface to human. No. If you are cleaning and the TB, if let's say a person is coughed onto a surface, and then you nak pergi, right? I don't know lah, for some reason like if you have the so it's very highly unlikely you get it lah. Right? Because it's easily treatable. Ultraviolet kills, right? So macam saya katakan tadi ya, kalau ada 10 orang, not everyone will get TB after inhaling. Hanya mungkin satu atau 2 orang sahaja. Kenapa? Bergantung pada sistem pertahanan, immune system. Also depends the amount of bacilli or bacteria inside every inhalation. They call it, the other thing they call it is inoculation, which means that it goes inside and stays and then replicates. Right? I'll give you a real case scenario here, right? During MCO, I had a 42-year-old accountant, right, who suddenly started coughing, fever, loss of weight, and came to see me, right? I did an X-ray. The X-ray is very suggestive, and I took a sample of the sputum of phlegm and came back as positive as TB. The first question to me is that, first of all, is denial. Betul tak? Doctor, you're lying to me. I don't have TB. Right? So how to convince her? No lah, come. Tengok. Ni TB tak? No, it cannot be TB. MCO, I was at home. I'm an accountant. I only work from home. I did not see anyone. How did I get TB? Valid question, right? So what do I do? Oh, you're very rude to me. I discharge you. Don't come and see me now. Is that what I'm supposed to do? Tak ada lah. So what did I do? I started asking her more questions, right? Now, okay, can you tell me about your past medical illness? She doesn't have any past medical illness at all. She is very, I would say, fit freak, right? She is very fit. She exercises, she eats adequately and all that. But what she told me after that is that her father had TB when she was 18 years old. Umur 18 tahun. Ayah dia ada TB. So, sekarang dia 42. Boleh ke? Ayah dia dah meninggal dah. The father has died. Not died because of TB, died because of other complications. Right? Now, I said, ta-da, you see? Lagilah dia marah. Dia kata, wih, macam mana? Dia masa tu umur saya 18 tahun. Boleh tak the bacteria stay inside of me until the age of 42 and then decides to pay me a visit? Boleh ke? In God, everything possible, right? All right. The answer is yes. Now, the question, why? Why did it choose to come to her at the age of 42 and not at 41 and a half? Why? Sebab, as I said, your immune system, right? Kita ada askar-askar dalam badan kita, betul tak? This is what I always use for my small children. How do you describe your immune system? We have soldiers inside, and there is one enemy, and do you know how many soldiers are surrounding the enemy? Plenty, a lot of soldiers. And how the soldiers, they know exactly where to go? That is God's wonder, isn't it? Right? You'll be surprised at what can God does. This is something I can't explain by science, right? So God, He created this. He says like, okay, this guy is an intruder. I'm going to send all my soldiers and going to take care of this guy. Now, these soldiers they work day and night. They will not slumber, right? But unfortunately, with the aging process, these soldiers may pass on. Sebelum tu ramai, satu markas, satu kubu, tapi sekarang dah kurang. So for every age process, your immune system, you suka ke tak suka, it will go down. And that one enemy, he suddenly said, hey, where was the soldier? I saw him yesterday, today tak ada. and started replicating. 2 become 4, 4 become 8, 8 become 16, and then she got a TB. Betul, pandai. Discipleship. Right? So what I'm trying to say is that the incubation period, you know what's the meaning of incubation period? When you are exposed to that particular bacteria until it shows the repercussion or the manifestation, you call it the incubation period. For COVID, it's roughly about 5 to about 7 days, right? For TB, it can be many, many years. Now, question I'm going to ask you. Is there a way for me to find out before the TB becomes active that I already have an intruder inside? Is that a way? The answer is yes, there is a way, right? So this kind of a people yang ada 1-2 ekor kat dalam tu, yang ada banyak soldier tu, are known as latent TB. Latent, you know what's latent, right? So they call it latent or dormant. So dormancy is actually, it's a risk factor for you to get active TB later on. Now, when the government realized, our government is a little bit slow lah, they only realized this in 2012. When I was sitting there, I was thinking, patient ni pernah tengok 2 tahun lepas, 3 tahun lepas. Masa tu, I kata, you tak payah rawatan, you balik rumah. Right? And then he comes again with active TB. Right? Then I'm thinking, the government started calculating, say that, wow, I might as well treat him during the latent TB, so that you don't come and see me during active TB, because I need to treat him even more elaborately. I have to spend more money, right? And then we came out with this program called latent TB treatment, right? Can you understand, huh? Latent TB treatment. So this latent TB is very easy to treat. The duration is shorter, but the only problem, you know what's the problem or not? You know what's the problem? Masalah dia ialah, how would you want a normal person to take medication? Oh, doktor, I akan dapat sakit kepala esok, tapi hari ini saya nak makan Panadol. Does it make sense? Would you do that? So how am I to convince you got latent TB, you better take the medication? But I've got no symptoms, what? Why am I taking? This doctor, sort. Tak betul lah, right? But believe it or not, now it's going to become a law. When it becomes a law, it becomes easy for me lah. Okay? You touch what? You masuk sana lah, lock up. Right? So what's going to happen, I'm going to tell you what's going to happen to you guys lah. So we're going to know a few people who is close with the index case, and then we're going to do contact tracing. And with the contact tracing, if you are a latent TB patient, and you are required to take the medication. Can I repeat what I said? If you are close to that index case who has got TB being treated, you will be called for screening, and if during the screening you find out that you have latent TB, kamu perlu mendapat rawatan. So there's no 2 ways about it lah. Very sorry about that. All right. All look very solemn. Tiba-tiba dah terkejut.
Okay, I got a question from some feedback. Okay, so there was a theory, doctor, last time during COVID time, you remember there was a theory about drinking warm water. So does this kind of thing help when it is TB?
Oh no. Okay, the warm water thingy again. Well, you don't stop drinking warm water. Warm water is good. Any hydration is good, right? You hydrate yourself. I'm telling you, I can sit down here and talk the whole day about hydration, right? It's good, but unfortunately, we have lack of evidence to suggest that it's going to improve on your immune response, right? Kalau katakan your askar tu ada 4 orang lagi, tapi nak minum air yang banyak untuk nak 4 orang tu nak tambah 8 orang, benda ni tak akan berlaku lah. 4 orang tu akan jadi 4 orang, mungkin dia akan jadi 3 orang nanti, right? So unfortunately no, the TB can only be killed using an anti-TB medication, correct? Unfortunately, I've been trained in the Western medicine with the antibiotics and stuff like that. I'm not too sure whether you can use any of the plants there to kill TB or not. So probably the wrong person to ask. So I have no evidence and I can't say no either. Kalau pesakit tu datang tanya, doktor, I nak makan kunyit dengan lengkuas, boleh tak elok TBI? I say I won't be able to tell you. I won't say no because I don't know, kan? But try not to take lengkuas and your anti-TB together lah, because they are drug-drug interactions, right? Yeah. Any other questions?
Boleh tak itu pesakit TB kan, after dia recover, dia boleh dijangkit balik lagi, macam dia kena pesakit TB?
Okay, lagi. Alright. Very good question, thank you. The answer is no, right? There is no transmissibility. Jangkitan hanya berlaku dalam tempoh yang saya katakan tadi, 10 hingga 14 hari. Tetapi I can be wrong, right? I'm not always right, isn't it? I can be wrong. Why? Number one, apa kata kalau pesakit itu tak makan ubat? Depan doktor kata, dok, makan ubat tak? Makan tak? Tapi belakang dia buang. So, can I say that the person is not transmitting after that 14-day period? No, right? So there's a patient factor, right? Number two, the dosage factor, maksudnya inadequate dosage can make the patient to still have transmissibility. That is not the problem. This is the doctor's problem. Doktor tak pandai kira. Ini muka besar tapi bagi 1 biji je, kan? Tak boleh macam tu. Doktor kena pandai kan? Tak pandai So dia kena pandai kira.
So I think what he means is if the person has TB before and then he was cured.
Yep. So that's why you call it cured. Cured, you're not supposed to, right? Tetapi I want to ask you another question. Can a cured TB patient can have a relapse? Right? So that is another question I'm sure you want to ask, but I asked first lah. Right? Can a person who I kata, okay, congratulations, saya akan bagi dia sijil. After 6 months of treatment, kita bagi dia sijil, kita akan raikan dia sebab dia dah berjaya makan ubat TB. Tetapi apa kebarangkalian yang dia akan dapat TB sekali lagi? Is there a chance that he'll get TB again? So the term that I use is relapse and reinfection. Relapse and reinfection. Relapse maksudnya TB dalam dia tu tak mati. Tak mati walaupun doktor kata, "Ui, dah makan ubat 6 bulan Tapi ada juga TB yang tak mati dalam badan dia yang dalam kadar 10 to about 12% that the person may get a relapse. Now, reinfection is different. Reinfection is with a different strain of TB. I'll give an example. Those who are prisoners. Siapa-siapa yang dalam bukan lokap, penjara. Right? Kamu tahu berapa lama seseorang tu kena ada dalam penjara tak? Bergantung pada kesalahan dia kan. Ada orang berkurun-kurun kat dalam tu. So this person will be going from one penjara to other penjara. And you know, because they're so close up, so one penjara, dia dah completed the treatment, they go to another penjara, do you think they should get TB? They can get TB. So this is known as reinfection, a different strain. So there is a possibility lah. Alright, or patient with HIV. HIV, you don't know what's HIV kan? Semua very innocent face lah here, right? It's right. So when someone gets HIV, right? So their immune response is very, very poor, right? And they can very easily get different kinds of strain, very easily. So, so the term that we use is relapse and reinfection lah. So the chances of them getting an antibiotic cured is very low, but there is always about 10% chance lah. All right. All bored already. Any other questions? Yep. Mr. Thomas.
Yeah. Doctor, people got always dry cough. Every now and then it's non-stop, even they take a cough mixture and all that.
Yep.
What is the symptom actually?
Okay. Thank
That's
you.
one.
Yep.
One more thing, when they are in TB, do they get prone to get this cancer?
Okay. All right. Okay. Thank you.
Cancer.
Thank you very much for the question. Yeah, okay. Now, the first question is that dry cough. So, when do you call it a dry cough? When do you call it a wet cough? Right? It's still arbitrary. Maksud dia lah, when you cough, you find something come out, you call it wet cough. When nothing come out, call it dry cough. Right? So, there are certain reasons why you cough. Most of the reason is lung, but there are also non-lung causes that you can cough, right? Can you tell me an example of non-lung cause that you like to cough? Right? Emotion, anxiety. And one more thing is that drug-induced cough. There are certain drugs, terutamanya if it's a medication for blood pressure. That one particular medication, if you take, it gives you a cough, a dry cough, right? Now, kalau macam tu, kenapa doktor tu nak bagi ubat tu? Kan? Can I ask the question? What is this doctor? He's trying to solve one problem, but give me another problem, right? But for 10 person who takes that blood pressure medication, only 8 of them will have no cough, but the unfortunate 1 or 2 of them can give cough. It's a very good drug actually, right? But if you are coughing and that cough is a dry cough, nothing to do with your lungs are perfectly clear. You buat x-ray 1000 kali pun semua normal, tapi dia batuk je. Dia tengok muka you dah batuk dah. Dia tengok muka you dah batuk. Right? So it's not a lung cause of cough, but it's due to a drug induced, so you have to find out why. So when you talk about cough, I always divide into 2. Upper respiratory, lower respiratory. Upper respiratory, you can cough due to your blocked nose, you can do due to sinusitis, post-nasal drip, or even gastric, you can cough. Another reason for coughing is your lungs, right? Fluid in the lungs. Have you heard about fluid in the lungs? Right? Ada air dalam paru-paru, you can cough. Infection, you can cough, right? Sometimes the wife also makes you cough, right? No. Bini tak bagi you batuk. Alright. Oh, belum ada bini lagi. Alright. The second question you're asking me was, can a TB cause lung cancer? The answer is no. So TB is infectious disease. Lung cancer, it is not. Lung cancer is actually due to a tumor, right? A tumor, tumor are 2 types. One is a benign tumor, one is a malignant tumor, right? So why do you get cancer? That's a different topic for another time lah. It's a whole lot topic. All right. Anything which is really pressing you want to ask about TB? Or you still want the 50 ringgit, this one from the hospital? Right. Thank you very much.
Okay, we thank Dr. Raymund for an informative talk.
我们谢谢Raymond 医生的演讲。
So I would like to call upon all of us here.
我这里要提醒大家。
So if we found out that there are 1 or 2 of us actually have TB, please don't treat them like lepers.
如果你发现到有人有 TB 的话呢，不要看他是怪物呢。
So it's like Dr. Raymond tell us, it's not their fault.
这个不是他们的错。
Okay, so let us in a community we practice, learn how to love and care for one another as family.
我们这个群体我们要彼此的相爱。
Okay, so we continue on with the CLM. I only have 2 very simple appeal.
下面我就有2点的提醒。
So these are some internal issues. I hope we won't bore Dr. Raymond.
这个是内部的事情呢。
So we over the last few weeks I have heard something about hostel.
这2个星期呢，我听到关于宿舍的事情。
One very good news is that now everyone can sleep very happily.
啊，现在好事呢是大家都可以安详的睡觉。
So everyone observe the so-called quiet hours rule very well.
啊，我们的这个安静的条例呢非常的有效。
So I really want to thank you for the cooperation.
谢谢大家的合作。
Let's work together to treat each other really as family and community.
我们要对待其他人呢像家人一样。
And next, I heard that slippers still go missing.
第二呢就是拖鞋依然有人不见。
So may I make a suggestion?
我可以这里做一个建议。
If this is a plank that you want to play on your floor mat, some of your friends 就开玩笑的啦。
如果你要跟你的同楼层的人开玩笑。
I mean, you hide the slippers when he's looking for it. That time, at least.